welcome back. It's been just about a month since we have talked with Dr. Paula Stewart, the medical officer of health. And so today I've invited her to Zoom with me so that we can find out how our area is finally doing. Dr. Stewart, welcome to the program. So how is our area doing?
Yeah, it's incredible. You know, it's been a month and things have changed so much in a month. We had a huge surge in cases. We had over 700 cases within about a 3-day window over December 31st, like the rest of the province. So the province really had to make a change in terms of how they were approaching this COVID virus. Omicron is easily transmitted if people are close together, if they're not wearing masks, if people are sick. And so they were causing so many infections that we couldn't actually keep up with the testing at the assessment centers and the labs. So they did a major switcheroo, which I think is a good idea because they've said we manage respiratory infections all the time ourselves at home before COVID came along, right? If you had a sore throat, a runny nose, a headache, a fever, you stayed home until the symptoms were better. And so really the new approach is to do exactly that. So that if you have COVID symptoms, one of the big four, so shortness of breath, breathing difficulties, fever, cough, or loss of taste or smell, very specific to COVID, then you stay home. And if you're fully vaccinated or under age of 12, you stay home for 5 days. If you're not fully vaccinated or you're immune compromised, so your body couldn't get rid of the virus as easily, you stay home for 10 days. And then because the virus is spread so easily in the household, your household members stay home as well for the same time, the 5 or the 10. And that really puts the control back in our hands. I know I had so many people call and say, I want to get it tested to see if I have COVID, but I can't get to the assessment center. And now you don't have to worry about that. Mm-hmm. And so really we're able to manage it ourselves within our families, which is, I think, important. We're reserving the assessment centers and the testing for people who are in high risk settings. Mm-hmm. So people who work in long-term care homes, the paramedics, the firefighters and police who do medical response, people who work in hospitals, people who are going into hospital for specific treatments or something. So it's very restricted to people who really need to know that they have COVID. And for the rest of us, the vast majority, we manage it just like we had been before. And I think I really like that because it puts it back in our hands and it says you can manage it, like you know what to do. Yes. So that's the big change that happened. And now lab results were taking 5 or 6 days to come back. They're now coming back in 2 to 3 days. We're hoping that's going to inch even closer to 1 day. So I think it was a critical change.
That's good. That's really good. But there again, we knew and we were told to expect our numbers to go up after the holidays. So we knew that it was going to happen. I was wondering how our retirement and our nursing homes are doing. How are they doing in our area?
Yeah. So we have, I think we have 12 of them right now who have at least one person, either a staff or resident, who has COVID. Mm-hmm. Some of them are struggling a little bit. COVID in older people who have chronic health conditions and don't have good immune systems can be really difficult. Mm-hmm. So the variation is from fully vaccinated, mild to moderate, and to severe, and some people have had to be hospitalized. So it's really important that if we are visiting people in long-term care retirement homes, any other group home setting, any place where people live together, so it's like a household, and it could potentially be spread, that we are really careful not to be bringing it in. So some are doing well, some are struggling a little bit, which is what you would expect. The homes, and we have worked really hard to make sure they all have their 3rd dose, and now we're actually giving them 4th doses, mm-hmm. because they had their 3rd doses way back in sort of August, September, October, and so now we're looking at giving them 4th doses just so their immune system get that extra little boost, so they'll be able to cope with it if they do become infected.
And eventually it will be opened up to everyone else?
Where the analysis is going on at the provincial level, looking at how well is the third dose holding people. We are still pushing hard to get that third dose into people, and we are doing really well. Like our 80s, we have 80%, 79.6% of our 80s have had their third dose. Thrilled about that. And then the 70s is 84%, 83.6, which is great, wonderful response. And the 60s, 71.5. So people have really come forward to be able to get those third doses, and encouraging the others to please do it. It just seems to give your immune system an extra little boost that you need to be able to cope with Omicron. The vaccine is pretty good at preventing serious infection, like 85%. Not quite as good as with Delta that was up at 95, but pretty good. But it's dropped quite a bit. Quite a bit below that. The estimates vary in terms of symptoms. Yes. And if you don't have symptoms, then you don't have to stay home, and you don't risk spreading it to someone else. So please go get the third dose.
Yes. And actually, some people out there that haven't had their first dose have gone to have it. So that's amazing that people are now realizing the difference.
Thank you. Thank you for that, because really the most unprotected are people who haven't been vaccinated at all.
Right.
If you get COVID, there's some protection with Omicron. It's not lasting very long, though. So that even if you've had Omicron, please go and get the vaccine. That gives the boost and the memory that your body needs in case you're exposed to the virus again.
Now, these test kits that have been released to the children, the school-aged children, as well as some adults now have them. You were saying earlier that even though you may have some of the symptoms of a cold or or whatever, your nose is running, and it doesn't necessarily mean that you have COVID, and it doesn't necessarily mean that you have to be tested. Is this not?
Yeah, so I think if you have one of those big four, or if you have two of the other ones, there's a high probability that you'll have COVID. And if you do, you don't want to be spreading it to others.
Right.
So to be very careful. Yeah. So the rapid antigen tests are useful in a situation where you need to be going to work. And so being 5 days off is a problem, or the child needs to be going to school. And so the children are going to be given 2 rapid antigen tests each to take home. And then as the province gets more, I expect more will come in. And that means that if a child does have a cough and a runny nose, then it means that you could give them the rapid antigen test. If it's positive, assume it's positive. You don't need to have it confirmed with the PCR lab test. If it's negative, though, on the first day, then you can do another one the next day or the day after. If they're both negative, then there's a high probability the child doesn't have COVID, and they just have to wait until the symptoms are better. Yes. And then they can go back to school. Yes. So the idea is to have a greater chance that kids can be going to school on a regular basis. But when you think about it, fully vaccinated 12 to 17-year-old only would have to stay home for 5 days, and an under 12 only has to stay home for 5 days. And a cold pretty much lasts that long, So but the rapid antigen tests give a little bit more information that the parent and the child can be using to decide whether or not it's okay to go to school.
Yes. So any other recommendations that you want to share with our viewers as to what they should be doing or not doing?
Yeah, I think it's really important with the weather. People aren't as likely to be outside. Still think about going for a nice walk in the woods or going for a walk down your street, just being physically active and connecting with people. Really important to think about social context now. Yes. And that if it's important for you to meet with someone, that you meet with a very small group in a big room. Really encourage people to still wear the mask now, to give added protection, and keep the distance that you can. I think that thinking about all the precautions now are really, really important. There are things we know what to do. We've been doing them before. Yes. Really important to do them well now. I would say even if you're fully vaccinated and if you want to be extra safe, then keep your mask on.
Yes, definitely. Thank you ever so much. It's always a pleasure to talk to you, and thank you for telling us about our area and what is happening out there.
You're welcome. Yeah, good to be back again.